another conscious conversation. I'm Debbie Clement-Large. I'm the founder of Why Follow the Herd award-winning coaching practice, and I'm really excited today to be talking to the fantastic Dr. Rory McGill. Welcome, Rory.
Thanks, Debbie. I'm looking forward to this conversation. I've enjoyed our previous ones, and I'm sure this will be just as good.
Me too, I really am. So let me introduce Dr. Rory to you. So he worked for many years as a traditional GP in a practice, saw lots and lots of people, patients over time, and then gradually got to the realization that there were more things than just what he'd learned through medical school. So now he runs his own amazing practice as a holistic doctor. And I am really excited to hear more about what a holistic doctor is. Rory, can you enlighten us, please?
Yeah, and a lot of people do wonder. So my business, as you know, is Plymouth Holistic Doctor. The Plymouth bit is easy. You know where that is. And I am a doctor, as you say. I qualified just like every other doctor and worked in hospitals, and then I was in the forces for a while, and then as a GP for 20 years in St. Peter before just deciding to leave conventional medical practice because I like the idea of natural medicine, and now I work in holistic medicine. So what's holistic? Holistic is looking at the mind, body, and spirit, looking at the environment, relationships, and work for the cause of why you're ill. So just like conventional medicine, we are interested in what is wrong with you, but much more so interested in what the cause is. Why are you ill with this particular condition right now? And we can usually find an answer. So sometimes if you've got, say, a muscular back pain that you've had for quite a while, you can have some treatment from a physio or chiropractor, and that may well resolve it. But if there's an underlying stress condition related to work, say, then it's probably going to come back unless you deal with that stressful issue. And on the other hand, if you might have an anxiety problem, which would be considered a psychological issue, and you can have anxiety management and so on, it may be that there's a blood sugar problem from your diet. And unless you resolve that issue, again, you'll carry on having your anxiety symptoms. So it's looking a bit more deeply for why you've got the problem in the first place. That's what I think of as holistic medicine.
So you're really bringing the whole mind, body, and spirit together, which is fantastic. Yeah. So
yeah, that's what I like to do.
So what happens when somebody wants to come and see you then?
Well, to a certain extent, it's like what happens in any doctor's surgery. I'll take a history from you, find out how long you've had the problem and some details of the problem. I may do some physical examination and tests, but very often the patient has already had that before they come and see me. So quite often I don't do that. I don't rely on tests and investigations that much. But we are a team. If you come to see me, we work as a team together, doing detective work to try and get to the bottom of that question of why are you unwell right now with this particular condition. And I actually want you to become an expert on yourself and on your condition, because of course, being the doctor, I've got to know about all conditions. You just got to know about yours and you. So by the time we've finished, I hope that you'll be at least as much, if not more, of an expert on you and your condition than I am. And I want you to be Googling away. I want you to be finding out information on your own behalf, as well as listening to what I have to say. So the first job is the detective work, finding what is this all about? And then, of course, what are we going to do about it? And I think that comes into three categories. First of all, if there's a problem which has got a cause, then we've got to remove the cause. And that may be looking at your lifestyle. It may be changing something about your lifestyle. your diet, your movement, your sleep pattern, your stress. Secondly, it may be about adopting some practices such as meditation and relaxation, or certain exercises, or even cold water immersion or fasting. There are all sorts of practices that you can adopt that will impact your health. And thirdly, of course, being a doctor, I do treat people a bit, as well as teaching them stuff and finding out stuff. And I do use hypnosis and acupuncture and biofeedback. So there will sometimes be some treatment, but whatever is needed, and we'll decide between us with our joint expertise what is needed to do the job.
I love the fact that you said that you were a team, that you work together, that you educate, and actually you explore and learn together and help the other person understand more about themselves. That just sounds so wonderful and so different to what you'd get necessarily when you walk into a traditional GP practice. You know, you're very often in there, a couple of sentences, maybe a quick check, and you come out with a prescription. But this just sounds like you're really learning about you and creating some really lasting changes, which sounds really exciting.
Yeah, so I'm not against prescriptions, and sometimes when a patient comes to me, after we've done our assessment, we think actually you do need a prescription, or you need surgery, or you need some conventional medical input. I'm not averse to that at all. That's holistic to do that as well. But I no longer prescribe medications, and I'm happy not to be doing so, because there are so many other tools in the box.
I find that really, really exciting. So I would definitely say anybody that would want to find out more about getting some treatment from Rory, that it's definitely, he knows such a lot and combines such a lot of holistic stuff together. So if somebody like me and I wanted to come and see you, I know that I've had a back problem over the years, and I know for me there's certain situations that trigger it off. So if I wanted to come and see you, how would I find out about you and where you are?
Okay, well, people find me in probably three main ways. Number one, sometimes people are just doing a search for holistic medicine, Plymouth, or integrated medicine, or something like that, and they'll Google and they'll find my website, and there's a contact form on the website. And I'm happy for people to use the contact form, or to use my email. Just email me directly or phone me, because the phone number's easily findable on Google as well. Some patients are referred by their GPs. I know a lot of the GPs, obviously, having worked with many of them, and some GPs are very happy to send me patients, for which I'm very grateful. And most commonly, people come by word of mouth. So a family member or a friend has been to me before and had a good outcome, and they give my details to you, and then you come and see me. So those are the main ways you come and see me. But I'm very happy for people to contact me, and I'm usually pretty good at replying within 24 hours or so. Because I want to see you, because I love what I do, and there's nearly always something that you can do. Nearly always there's something you can do to resolve whatever problem you have.
Yeah, you can definitely tell that you love what you do. That passion comes across in what you say and your knowledge, and yeah, just everything. So what's your website called?
So the website is www.plymouthholisticdoctor.co.uk. Bit of a mouthful, but that's the website.
So plymouthholisticdoctor.co.uk. So if you're out there and you're wondering, actually there must be more to getting some help through whatever illness or whatever disease or whatever pain or anything that you feel, any level of discomfort, and you want to get it sorted, and you'd like to get an holistic approach to it with the mind, body and spirit, Dr. Rory is definitely somebody worth speaking to. He is really great at what he does. So you can catch him at plymouthholisticdoctor.co.uk. So thank you, Rory. It has been really exciting, really great finding out a little bit more about what you do and actually the real benefits that somebody can have from coming to see a holistic doctor like yourself.
Thanks, Debbie. I've really enjoyed it, and I do hope that gets the message across that there's a lot more to this than people might think. So get in touch.
Definitely, definitely. Thank you. It's really great having a conversation with you, and I hope to speak to you again soon too. And have a really great day. Thank you for joining us.